Hi, we've made it to the end of the first week of conversations about your new diagnosis of borderline personality disorder. First, we defined the symptoms of BPD as well as its major driver, that is interpersonal hypersensitivity. Then we oriented to some basic facts you need to know to appreciate that you're not alone and you can get better. The last thing we're going to discuss this week is the interaction between borderline personality disorder and other psychiatric conditions. BPD rarely occurs alone for a patient. Most people with BPD have a number of other psychiatric diagnoses. What this means is having BPD causes people to be very sensitive to stress and have difficulty being resilient. Therefore, they will develop other disorders such as mood and anxiety problems, as well as behavioral conditions, sometimes related to their impulsivity. Given the complex pattern of co-occurring psychiatric disorders with BPD, it's important for you and your healthcare professional to understand how to prioritize the treatment of these separate conditions. I like to think about it in three ways. First of all, there are disorders that are commonly co-occurring with borderline personality disorder, such as depression and generalized anxiety, that usually respond better to the treatments that are designed for those disorders if BPD is treated first. Now, this makes sense, right? Because if you're having problems of mood, relationship, and behavioral instability, it's going to be hard to not feel depressed or anxious. Studies show that when you have BPD and it's not treated, depression and anxiety last longer for the patient. So the key tip here is that for depression and anxiety, you want to make sure you prioritize the treatment of borderline personality disorder. By doing so, you make these other conditions more responsive to treatment, and you diminish the cause of depression and anxiety. Now, there are other anxiety disorders that are treated with exposure therapy. What that means is that you might have fears of things like contamination or disorder causing OCD or obsessive compulsive disorder, or you could have PTSD, where because of trauma that you experienced was so overwhelming, you tend to avoid or escape situations that remind you of that trauma. These conditions require patients to be exposed to the thing they fear in order to gain the skills they need to cope and see that they can survive. This enables people to have a more functional life. The punchline here is that when you treat BPD, a person feels more stable and capable of handling these exposure therapies for OCD and PTSD. Lastly, there are a small group of disorders that impair a person's thinking and learning. These disorders need to be treated first so that a person with BPD can learn to learn and think about changing. For example, people who have attention deficit disorder will oftentimes respond to medication management so that they can focus their attention on the ideas they need to absorb in order to change their reactions to stress. In addition, some disorders cause changes in brain functioning, such as anorexia. Those who have restrictive eating to a point that they're anorectic oftentimes become more cognitively rigid, so it's difficult to adapt new ideas. Therefore, treating anorexia first is really important. Lastly, people who struggle with substance use disorders are oftentimes in an altered mental state that impairs their capacity to think first and learn to do things differently. Whether you're abusing legal substances such as alcohol, in some places cannabis, or illegal substances or drugs of abuse, in addition to prescription drugs, this can interfere with your treatment. What I want you to know is disordered use of substances is really common when people have BPD. And there's ways to address the substance use disorder enough so that you're stable enough to work on your problems of borderline personality disorder. In summary, I want you to think about this. It's normal to have other psychiatric disorders when you have BPD. It doesn't mean that you're broken beyond repair. In most cases, with depression and anxiety, treat the BPD first. In other cases where the treatments involve exposure and can be stressful, you want to also stabilize yourself in terms of BPD first. But when you have conditions that impair your ability to think in an organized and clear way and to decide to change your behavior, that's when you have to treat the other conditions first, such as ADHD, anorexia, and disordered substance use. I hope that organizes the scenery for you in terms of all your different diagnoses. Thank you for listening this week. We've made it halfway. I hope it's given you a lot to think about that gives you hope for your future. I'll see you next week.